Hi, I'm Dr. Craig Escude. Welcome to Medical Monday. So in practicing medicine, we have a term that we call the chief complaint. And it's basically what is the presenting issue, the presenting problem that a person is seeking medical attention for? Well, in my practice relating to people with intellectual and developmental disabilities, often what would happen is someone would come in with a person with a disability, and their chief complaint, their presenting complaint was, he's just not acting right. The second most important or most prominent question that I would get was, she's just not eating. And that's pretty challenging. That is really challenging as a clinician to know what to do or where to start. So clinical pearl number 16 give some information, give some questions that we can ask as a healthcare provider to get more information. And if you're a supporter of a person with an intellectual disability and you accompany people to health visits, these are things that you might want to have the answer to, or might be things that you might want to start off with to add more to your chief complaint than just, he's just not acting right. So, you might want to ask, how is this person different from their usual self? Is their behavior different? Maybe they could feed themselves on their own normally, but now they are having trouble picking up a spoon, for instance. So that might be an example of how they've changed from what their baseline is. How does a person usually show that they have pain? So are they showing pain by some of their behavior, or what's different? When was the person's last bowel movement? Now, I can't tell you how important that is. We've talked about this in other clinical pearls. You may want to, in other medical Mondays, you may want to review those because a bowel function can have a great impact on the way a person is acting, and they may not be acting right or may not want to eat because they're having some bowel issues. If the person has seizures, it's really important to know the person's seizure history. Are there any recent medications that were either started recently or changed recently that could be having an impact on the person? Has there been any weight loss or weight gain? Very important issues. And the change in weight, not just what they weigh today, but has there been a change recently? Have there been any environmental changes? It's not always something medical. Sometimes a person has a new roommate that they don't like, or something changed in their routine, and it's causing some other issues. So these are a few questions that you can ask, and you can look at more of them in Clinical Pearl number 16 in the book Clinical Pearls in IDD Healthcare, that can give you more information about what to know about, what's important information that can help a person when you go to the physician's office to have better communication and to end up with a more accurate diagnosis. Many of the topics that we cover on Medical Mondays can be found in the book Clinical Pearls in IDD Healthcare. It's available at replacingrisk.com in the store.